Good morning, everybody. Welcome to another Mancoll Minute. I hope it's been a great week. We've been doing awesome here. So again, lots of questions, especially on body contouring. So today's question was a bit of a unique question in the sense that it's a unique part of the body. Now, liposuction is an amazing tool. It's an amazing technique for removing fat and to some degree stimulating skin, but I've got my newbie on for more skin stimulation if I want it. But this was a question about lower extremities. A patient who felt like she had cankles, and for those who don't know what cankles are, those are where you just get fatty deposits that sort of hide the contour of your legs and around your ankles, ankle. It is a pretty sensitive area of the body to operate in, and certainly to do fat debulking, and you have to be very careful because you've got to really appreciate the anatomy down there. And it's not that there's lots of terrible things you can get in trouble with, but there's some important things you can get in trouble with. So I've done a lot of lower body liposuction over the years, as well as doing a lot of lower extremity reconstruction. I'm pretty familiar with that anatomy. So I can tell you that lipo down there is an awesome technique for shaping and sculpting and trying to bring out that Achilles tendon shape and craft the calves to define the gastroc muscles, both heads, the inner and outer one we call medial and lateral. And they can do a wonderful job to take folks who maybe they're uncomfortable wearing certain shoes, or there's quite honestly pants they can't get into because they tend to be tapered, and then when you get down to the calf and the ankle area, they're just too tight, or certain boots you just can't get into. So it's a great technique for debulking the lower leg from the knee down as well as the thighs to try and create a more aesthetic shape, more athletic look, things of that nature. But you do have to understand the anatomy. The other part about it is, of all the places I lipo, I'll tell you the lower legs tend to hold on to swelling for a while. So I tell everybody, listen, you can put away your loafers and your shoes. You're going to be in flip-flops for about 6 weeks because you'll get a lot of swelling in your feet. I have everybody wear compression garments afterwards, fajas people say, but most fajas will, at the best, will come down to mid-calf. You're going to have to get compression socks as well. Other than that, you know, the poke holes to kind of get in there are a little unique. I've got extra long cannulas that I use that have a little bit of curves to them so I can kind of hide in some of the creases around the knee, but you still can't get around having to have a poke hole or two around the ankle or so just to get to that part of it to really contour. But for those that are interested, it really is a great way to take a part of the body that you can really only blame genetics for having just kind of the legs that are too kind of solid or tree trunky, that you just want more shape and athleticism to. So if it's something you're interested, let me know. Happy to go over it with you in a little more detail, kind of look at your legs, kind of feel for the muscles and the tendons and figure out what we take out and where. But it is a great operation for those that part of their body is what troubles them. So with that said, great question. Have a great weekend. We'll talk to you next week.